The purpose of this video is to provide a basic overview of the safe handling of a respiratory decompensation emergency. In this video, the primary RN will appropriately escalate her patient's airway decompensation in order to provide the best possible outcome for her patient. She will ensure that all necessary team members are present and ask for help from additional nurses. The video will also showcase each of the tools and medications that one can expect to use in this type of emergency. Gianna, the primary RN, is taking care of a 30-year-old lung transplant from 3 days ago who was extubated post-op day 2. Gianna appropriately responds to a DSAT alarm by going to assess her patient and the situation.
Okay, I'm going to sit you up. You're on 2 liters. I'm going to put you up to 6. Deep breaths through your nose. Okay. Anyone there? Can I have some help, please? My patient's desatting. I'm going to call SICU if you guys can call charge and respiratory. I'll call charge and respiratory.
Okay, I'll put a non-rebreather on her because she's only satting 83.
Okay. Thank you. Hi, it's Gianna. I'm calling about bed 10. She's desatting. We put her up to 6 liters. She was still only satting 83, so we're putting non-rebreather on her now. She has obvious increased work of breathing. If you want to come by. Thank you.
Charge is on the way, respiratory is on the way.
Right, take some deep breaths. Alright, the sat's not really coming up.
Gianna, I'm gonna go get some supplies in case Blake wants to intubate.
Okay.
Gianna already had the correct bedside emergency equipment in her room, which included suction and yank gower, nasal cannula, a Christmas tree, non-rebreather, and ambu bag, and was therefore able to appropriately escalate patient care. While Gianna stays with her patient, her coworkers work to gather all of the supplies that will be needed for an intubation. They will need RSI meds, the glide scope, the intubation box, and potentially the advanced airway cart if a bronch is needed after the patient has been intubated. Respiratory will bring and set up the ventilator. RSI meds can be found in the Omnicell. The advanced airway cart and glide scope can be found in the main equipment room and the closet by bed 2. Intubation boxes can be found on any of the code carts around the unit.
Alright, so we're going to pre-oxygenate her. Like you said, it's looking not great, so we got to hurry up. So we're going to do 20 batomidate, followed by 50 of rock, followed by 50 of probe, and then flush it all in.
Alright. Ready? 20 batomidate. 50 rock. 50 of probe. And flush.
Okay? Cool? Great.
Now that the patient has been sedated and paralyzed, the provider must act quickly to intubate. Respiratory will be on the vent and ready to connect the patient. Once the patient is connected, a quick placement check can be performed with the CO2 detector, but will soon be confirmed with an X-ray. Should the patient have a difficult airway and need a surgical airway, you may call 33911 and ask for a surgical airway. Thank you for watching.